Good evening. Dev Sans Diutum Kasomestang. Welcome to MCA-EC's Empower Me series. My name is Merlin Mendonça. I am your moderator of today's session. Today's topic is Promoting Success, Reducing Stress in Teens. Please submit your questions here at any time during the session in the chat box. My name is Merlin Mendonça. I am your moderator of today's session. Today's topic is Promoting Success, Reducing Stress in Teens. Please submit your questions here at any time during the session in the chat box. We will answer the questions at the end of the session in the order they were received. I am a mother of two teenage kids. It's not easy to communicate and understand them, especially as they were born and raised here in the US. There are a lot of cultural differences from how we grew up in India to here, and we try to compare them at times, which irritates them. My parents might have gone through the same issues when I was a teenager with my mood swings, which is common in adolescence. Is it everyday stress or something more serious like major depression, anxiety, or a substance use issue? How can you tell the difference? What are some of the coping mechanisms? Let's learn them today from Dr. Aparna Kalbag, who is a health researcher interested in studying illness conceptualization and health behaviors in ethnic minority, immigrant, and global communities. She received her doctorate in clinical psychology from the University of Colorado at Boulder and completed her APA-approved clinical internship at Beth Israel Medical Center in New York City. Dr. Kalbag then served as Research Scientist 3 with the Division of Substance Abuse at the New York State Psychiatric Institute at Columbia Presbyterian Medical Center in Manhattan. She also served as a National Institute of Mental Health postdoctoral fellow at the Institute for Health, Healthcare Policy, and Aging Research at Rutgers University from 2007 to 2009, and subsequently completed a postdoctoral fellowship at Robert Wood Johnson Medical School in Global Mental Health from 2009 to 2011. The primary focus of her current research is on factors that hinder accessing health services by immigrants from South Asia. Most recently, as one of the founding members of SAMBAV, South Asian Mental and Behavioral Health Advocacy Group, she has conducted parenting workshops in school districts around New Jersey on promoting success in teens. Now let's all welcome Dr. Aparna.
Hello, everyone. Thank you so much, Merlin, for that wonderful introduction. And thank you to MCA for inviting me to this talk. What I would like to start with is just to let you know a little bit about my background. I was born in India, and then when I was about 6 years old, my parents immigrated to the US. So I grew up here through the school system, and then, as Merlin said, completed my doctoral work here. And now I've been in New Jersey since 1999. So with that, let me start my PowerPoint. Okay. And okay. So the title of my talk today is called Promoting Success, Reducing Stress, Helping Your Child Through High School. And this is a talk that we have done at many different high schools and middle schools throughout New Jersey. It's something that started with work when I used to volunteer with NAMI New Jersey, the National Alliance on Mental Illness. And Aruna Rao is the associate director there. And then Priya Gopalan, Sudha Nagarajan, and myself and Aruna most recently presented at West Windsor High School to their PTA. So those are the slides I'm going to be sharing with you today. The important thing to remember is with the that this is really a training. We're going to be talking about mental health issues, but really what we are focused on is educating you as the listener, parents who are interested in improving their understanding of their adolescents, including risk and preventative factors for the development of serious mental illness. This session is not a therapeutic service and should not be considered as such by the audience. In case medical, psychological, or psychiatric intervention is needed, please talk to your primary care physician or school counselor to get appropriate referrals in your area. And in case of emergency, please call 911 for immediate help. Referrals for bilingual mental health providers in New Jersey can be found at the NAMI New Jersey website listed, as well as the SAMN website, which is listed next. MCA-EC is not responsible for any of the content presented here. Okay, so I wanted to start with just understanding a little bit about what we're going to do today. Our goals are really to understand and start a dialogue on what adolescence is. Adolescent development and the issues which our teens are facing is something very unique to some of us who have come from, the Indian subcontinent. It's not something that maybe was discussed in our homes growing up, but it's something that obviously needs to be talked about because we need to understand it as a very specific part of the developmental process for kids. And then it also helps us identify what their emotional needs are. The second thing I'm going to do is just introduce you. Like I said, we were doing these as part of a larger training session, but I just want to introduce you to one of the activities that we do in person, and this is in communication training. What we do with that is we try to address parental concerns about things that they would like to communicate with their adolescents, but also provide the parents with some tools in how to communicate. Again, that's something that's not done very regularly in our families. Some may be lucky where, you had a parent or parents, grandparents who are very intuitive about what a kid was going through. But if you didn't, then there might have been some difficulties. And in India, at least historically, it was taken care of by saying, no, kids don't talk, parents, you take control and everything's going to be the way the parent and the grandparent wants it. And that somehow that model doesn't necessarily work all the time in the US, but we're going to talk about how to negotiate some of the cultural friction that might happen in our families. Okay, so the first thing I wanted to do was just go over a little bit of the teenage years and give you a sense of what's happening. This is really a time in the adolescent development when their brain is developing, but it hasn't completely developed. Usually, researchers have found that it takes at least until age 25 for the brain to completely become an adult brain. So here we are in the US where, our children are considered adults by age 18. They're given rights to vote, drive, they can even set up their own residence. And yet we come from a culture where our forefathers and foremothers have always sort of helped us as a new family in either becoming whole within an extended family situation or really being there until a child has married and gone into a new home, for example. But here we are in the teenage years, ages usually, 12, 13, all the way up to 19 are considered the teenage years. But like I said, that can extend into the early 20s. And there's huge leaps in brain development during this time. The limbic system, which is sort of the base of our brain, is really the part of the brain that controls emotions. The brakes of good judgment are in the forefront of our brain. The prefrontal cortex, it's called. So what's happening is that the limbic system is quite active during this age. You will get a lot of emotional reactions from adolescents. There'll be maybe anger outbursts. There might be rage. There might be aggression. Also very, very insightful comments. And some of that really comes from that emotional insight that you can have when your limbic system is working. But what a lot of kids don't have at this age is that ability to put the brakes on. So when you're getting really worked up about something, to slow it down. So that is the actual development that we're talking about in this age group. And as these experiences of rage, fear, aggression towards both oneself as well as others, excitement about growing up and having independence soon, as well as sexual attraction, these are feelings that are all sort of coming at our teenagers all at the same time. So if you're noticing your kid being overwhelmed, sometimes you might want to think back to this particular lens of looking at how your child is developing. On the other hand, hormones are also starting to be secreted in the body of our teens. And so the brain development is influenced by these hormones, as well as sex hormones, growth hormones. And for example, in adolescent boys, testosterone increases by 10 times as much, tenfold increase in testosterone during these adolescent years. And that can be the overwhelming thing for a lot of kids. So one of the things that we wanted to talk about is how teenagers face their stress. And a lot of times they don't have the ability to cope. Here they are, put into a new situation in our schools, on maybe sports teams, playing in orchestras or any other activities that they do. And they're not really in a place to understand what's happening when someone makes a comment, when someone says, "Great job," just like that, with no excitement, with no, nothing else said. They may misperceive what's happening. Is the person really giving me a compliment? Were they being sarcastic? They're unable to determine the difference between this. And they feel very self-conscious during that time. They also become more vulnerable to engaging in risky behavior. So they're more likely to listen to their peers rather than their parents. And a lot of times this stress is really what can set off a mental illness for a child. So teen years as a transitional period in our lives is really a time when we need to be careful and give our kids more protective factors to stave off anything happening. And we see this both at throughout adolescence. Also, I would say that in my personal experience, both having gone through college here in the US, is that that transition from high school into college is another time when their independence, they really need to rely on their independence to, especially if they're going away for college. So it's really important that we as parents sort of give them as many tools as possible to take care of some of these sort of tasks that they need to be able to complete. So we have a bunch of things to consider as parents. We want our children to succeed academically. That's obviously a shared value for many families. We also want our kids to stay close to their family. And generally, not again every family, but a lot of times when we hear a child say something like, "Mom, just leave me alone. I just want to go up to my room. I need space," our Indian brain, I'll call it, turns on as a parent, and we say, "Well, why do you need space? Are you doing something you're not supposed to be doing? Are you, talking to someone you're not supposed to talk to? What are you texting? Are you on your phone? Where are you?" So this creates suspicion. And one of the main important things that we're going to talk about that help parents and children communicate is trust. So we're going to talk a little bit about how to develop that. And of course, we have fears regarding drug and alcohol use, and concerns that their moral development is not in line with the morals maybe that we have here, again, because of the larger society having a different norm than what we are used to growing up in India. So the first thing I wanted to do before we talk about communication is talk a little bit about what are the risks that adolescents can go through in terms of mental illness. These are the definable illnesses that we can talk about. Now, all of us go through sadness at times. We may feel down for a day or two, or even 3 or 4 days. If someone in the family passes away, we may feel loss for a much longer period of time. But there is something definable that psychiatrists in the US have come up with which is called depression as a mood disorder. And I want to describe that a little bit to you. A mood disorder is considered a disorder when a child is experiencing symptoms, which are, I'll explain what symptoms are in a second, and these symptoms are affecting how you feel, think, or handle daily activities like sleeping, eating, and working. So the symptoms must occur every day for at least 2 weeks, and some of which should include the following. So the symptoms are things that occur all the time. Like I said, when you read this list, you may see things that you have felt from time to time. You know, you forgot to pack your spouse's lunch. You may feel guilty that they went the whole day without lunch. But these are consistent and persistent feelings that we may have in terms of what someone is experiencing. So two of the most important symptoms to pay attention to are a sad or anxious mood, and anxious meaning feeling nervous, feeling jittery about things, not sure at all about how things are gonna happen, the future. And sadness a lot of times is about maybe what has happened in the past or what's happening currently that people may feel. And the second one is loss of interest in things that used to pique someone's interest. So with adolescents, we might see them becoming less interested in their families. They may be less interested in activities that they were doing, playing soccer or going to temple with us, those kinds of things. And then they need to have some of these other feelings of either guilt, hopelessness, feeling helpless about maybe their grades or pleasing people. People have these feelings about a whole bunch of things that are going on in their life. They may have decreased energy, etc. So the best thing to do if someone is feeling these is obviously get treatment. And the earlier we can identify something like depression, the more likely we are to do two things. One is to treat it, obviously, right before it becomes more serious. And two, research has shown that if we can stop it, what happens at the neuronal level in our brains is that you can stop the circuit happening within the brain where as someone feels sad, this becomes kind of a response that people can have to a stimulus. So I get a bad grade, I feel sad. I get another bad grade, I feel sad. That happens enough times, or, my mom yells at me, I feel sad. If that happens enough times, what happens is the brain just takes over. It becomes automatic. And what you can have is then a life where you have many of these episodes one after another. So what we want to do is, obviously, the best case is to prevent these symptoms from happening. But if we haven't been able to catch it in time, which is, very understandable because we haven't really understood what all of this is, the next best thing is obviously to change some of the circuitry, and some of the communication training that we do really aims to do that. Obviously, when depression gets very serious, kids as well as adolescents as well as adults can have thoughts of wanting to end their life or actually attempting suicide. It could be something as simple as something like cutting on their arms with a blade. It could be something like wanting to go through someone's medicine cabinet and taking pills. It could be something more serious like starting to take drugs or drink alcohol in a very in a way that they want to end their life, or if they start talking about it even. This is something that needs to be taken very seriously, and you do need to get help. The best thing to do is to talk to your primary care physician or the pediatrician that's treating your child, and they can refer you to a psychiatrist who can prescribe medication, which will help the child be able to, again, remove the circuitry that's causing some of the symptoms that you're noticing. So suicide, like I said, is one of the most serious consequences of major depression. And as I have listed here, these are some of the things that you might see: the increased alcohol or drug use, aggressiveness towards family members and friends, social withdrawal, and dramatic mood swings. These are some statistics just for you to understand that depression and suicidality is something that is, unfortunately, we've checked it. We've started educating more and more people about it. So it's something that families are talking about, and hopefully addressing very quickly. But within our South Asian community, sometimes I worry because we are a community that is very focused on, getting academic success, on being able to have these wonderful outcomes. And that's all very wonderful. I think that's one of the most positive traits that we have in our Indian and South Asian community in general. But one of the things that I think will upend all of this is if we don't pay attention to what's happening to our emotional health. And so I urge all of you to start helping your kids take care of their health, just like you would tell them, you have a cold, let's treat the cold. You have, asthma, let's go to the doctor and get a medication for that. So the same way, mental health disorders are something that are treatable, and we would like to help our South Asian community be able to access treatment in a timely fashion. So these are some of the national statistics. We also have some of the New Jersey statistics. 10% of kids ages 12 to 17 have experienced a major depressive episode. So you take 10 Indian kids, at least one of them has experienced a major depressive episode, whether we have identified it or not. So it's very important that we educate ourselves, look out for our friends, kids, people that we connect with in our social or cultural manner. And then, of course, like I said, 18 is not some cutoff where all of a sudden all the problems go away. In the US, since many of our kids go off to college, that's also a time when we really have to stay in touch. And with kids moving away for college, that's a very, very critical time when parents need to have excellent communication skills with their kids so that it can sort of traverse the distance between parents and the kids. They need to have that independence. So it's not a situation where we have to keep them super close to us and never let them out of our sight. They need to experience the independence that, US society sort of has encouraged over the generations. That's important for them to be able to meet some of their academic career and social and personal goals that they have. But we also need to be aware that there is a transition period when we need to still be paying attention. Okay, next is anxiety disorders. And this is an excessive or unrealistic worry about everyday tasks. And again, this is the most common mental illness found in the US. It affects about 40 million adults over the age of 18, so almost 20%. That means 1 in 5 people is experiencing anxiety at the disorder level. That means, again, where it's affecting how they're performing at work or school. The other thing that you might see at this age is disturbances in eating behavior, either reducing the amount of food that somebody eats, not eating at all, or extreme overeating, binging on junk food, etc. And at least 30 million people suffer from an eating disorder in the US. So again, these are disorders that a psychiatrist or a psychologist can identify with you as a parent. So if you have any concerns about your child, I really, really encourage you to go and get help. I'll share a story very quickly with you. When I was in college, one of my friends who was of South Asian descent was going through a crisis herself. And unfortunately, and this was back in the 80s, if I'm dating myself here. So I graduated high school in 1989 and finished college in 1993. So it was in that time frame. And one of my friends was going through a pretty severe crisis. In fact, she had attempted suicide, and this was someone of South Asian descent. And the parents were very, very reluctant to talk about it because there was a lot of shame involved. And part of what we want to do by educating our community is to, when you hear these stories of someone going through a difficult time, our first instinct might be that learned tape that we have in our head. Maybe we've heard it from our parents or from our extended family where people question, oh, what are they doing wrong, or what's wrong with this family? Instead, I encourage you as people who belong to a community that celebrates so many different things together, holidays and birthdays and marriages, to also be there at times when our families are in need. As individual families grow up here in the US, we need to have that support from each other. So I encourage you to think about how you can look out for these symptoms that I'm describing, not just in your own kids, but also in your extended social network. Okay, substance abuse is also something that we need to be very, very careful about, not just in high school, but definitely in the college age. It's something that you may see only at a later stage, because it's not something that substance abuse comes with a lot of ability or motivation, I should say, to hide the substance use as it's going on. So part of what we want to do is be able to identify what's going on. And you can see some of the types of abuse that we see commonly at this age: alcohol abuse, and that interferes. Maybe it doesn't interfere right away with alcohol. Maybe, someone can handle binge drinking in college once or twice a week, and it can go unnoticed for a long time. But once it does start affecting their ability to maintain social relationships, or be able to connect back with their family, or be able to keep their grades up, etc., we know that it's already started taking hold of the person. Hallucinogens are things like LSD. Sometimes in college environments, you will see kids saying that they're taking mushrooms. It's also something that a lot of times gets laced into things like marijuana, which is, as you may know, in New Jersey, that's something, there's a big debate going on about legalizing it. So again, these are things that we have to educate ourselves about as parents. But also, if we don't have the information, go to professionals and ask about this, because it is something that very quickly can take hold in our kids, and the consequences can quickly accumulate, especially in an environment where we don't have our extended family to help us immediately. We're kind of all doing this single-handedly in our nuclear families. Opioids are things like heroin, which again in New Jersey, there's a huge crisis of opioids. It usually, or it can start a lot of times in teenagers by them using pain medication from their parents. And then that goes into heroin use, etc. So it's something, again, to watch for. So here are the mental health red flags that I want you to focus on. If you see changes in sleeping patterns, either sleeping too much or not sleeping enough, kids usually, I'm going to go through how much sleep they need, but if you see any changes, it's a sign that you may need to go ask for help from the doctor. Loss of self-esteem, or how they feel about themselves, the loss of interest in pastimes, academic performance, which is something that a lot of families obviously pay attention to. So that one is something that, you can quickly find out if something is going on. Weight loss or weight gain, personality shifts, like the aggressiveness or excessive anger. Again, some of this is normal. Your child who wasn't aggressive all of a sudden becomes very angry. That might be just part of that normal adolescent development. But if it's something that's affecting their social relationships, they're losing friendships, etc., that's when we know that there's something else going on. And changes in social networks. Okay, so what are some of the positive things we can do? Are encourage extracurricular activities, especially ones that are not super focused on competitiveness, just relaxation. Trying to have relationships with their extended family, either back in India or South Asia, as well as aunts and uncles, their peers and friends, where it's not about competition, but it's really about support. So thinking about how to do that. And having people to talk to is the most important protective factor you can give anybody. That's why talk therapy has worked in the US, especially, for so many years. Because with this nuclear family, we tend to isolate ourselves more, and talk therapy really helps with that. So the importance of sleep. The number one thing, it doesn't matter how many AP courses your child wants to take in high school, I please urge you to think about making sure that they get enough sleep every night. And here are some, examples of the sleep that's required throughout the lifetime, from an infant all the way up to adult. So in high school, we're talking about 8 to 10 hours are really required for kids. And that's sometimes very hard to do with academic loads. So when you think about choosing subjects for your high schoolers, please think about the sleep that they're going to get. Okay, quickly, I'm going to talk a little bit about communication skill building. This is something that we as Samba professionals, and I'm going to explain a little bit about our group, have been doing in middle schools and high schools throughout New Jersey. I want to say for at least 4 or 5 years now. And we've done an educational piece, but the piece that folks have really been asking for in person is teaching parents how to communicate. So one of the tasks that I love to teach parents to do, and this is not just South Asians, all parents need help with this. Even psychologists need help with this, with their own kids. So it's something to think about. This skill that I'm going to introduce to you now is called active listening. Active listening is an ability to listen to somebody, not to judge them, not to give a solution, not to change what the person is going to do or is doing, but really just to listen. And our job is just to reflect back as parents what we are hearing. So let me give you an example. My 13-year-old comes home from school really, really upset because she has so much homework and she has to get to her soccer game tonight. And she's got a violin recital coming up, at the end of the week. She hasn't had time to practice that. So she is stressed. She comes off the bus. She's panting. She's stressed. I say, do you want a snack? She's like, no, this is what's happening. And there's panic in her voice. And my first instinct as a parent is to want to solve that for her. I want to tell her exactly what it is that I think will help her. I want to remind her that she has the violin recital, that I want her to practice that too. Don't forget. And instead of that, what I'm going to do is take a deep breath, stop myself, and just look at her visually as well as listen to her. What is she saying? And I'm going to reflect back. So what does that mean? When she says, I'm so stressed, I can't, Mom, help me, I can't deal with this. I just don't want to take this test tomorrow. I'm stressed. So what I say in a calm voice to her is, let's say my daughter's name is Joanne. Joanne, the thing is, it sounds like you have a lot on your plate. It sounds like you're trying to make sure that you meet all of the demands that are going on at school as well as home and your extracurricular activities. And you're not feeling like you have a chance to take a breath and just even plan how you're going to do this. Is that right, honey? If I say that, what that does is that tells my child that I'm actually listening to what they're complaining about, and I'm not trying to solve their problem. I'm just listening to the emotional quality of what they're saying. And if we can practice this as parents, what happens is it helps us hook into our children. It helps us get more information from them. The number one complaint I hear from parents is our kids won't tell us anything. There's a reason for that. And we as parents have to take responsibility for that. So our communication skill building is a series of exercises that we do with parents that really help develop that ability to listen and then respond in a way that helps our children feel trust with us as their parents. Because I'm telling you, that is the number one relationship that's going to get your kids successfully from adolescence into their young adulthood and beyond. It will continue. I can tell you, my mom is in her 70s, and because we have developed this communication over time, it's taken lots of failed attempts, and she didn't have any of this training, and I was learning it as a professional, but I didn't know how to communicate properly either as a kid. So this is something that we have to practice in our families. But I promise you that it will be something that will help you over time. Okay. Quickly, I'm going to go over this. We have a survey, and I'm going to click on that so you can see some of the questions. These are things we would like some feedback about the session that you've heard so far. And just click on this. Please click on the link and then fill out our questions. The first one is please select all that apply. If the information that I just presented today was useful, if the slides were clear, etc. The second question is on, would your organization be interested in hosting or attending an in-person communication skills training? So this could be obviously MCA, but also other organizations that you're involved with, maybe a housing cooperative or your kid's school, cultural organizations that you're involved with. Please give us your contact info if you would like more information from us. And also give us some feedback on what other topics you would like to hear about. We may be doing this more in a series in the future, and any other comments you'd like to provide for us. Okay, the last thing that I want to talk about, and I'm going to take myself out of this. Let me see if I can get myself out of here. Stop sharing. Okay. All right. So the next thing I wanted to talk about is also SAMBV, which is the group that does this training. And initially, we were volunteers with a group called SAMAJ, Understanding Mental Health, which was a program of the NAMI group, a National Alliance on Mental Illness. And NAMI runs support groups for folks who have mental health disorders, diagnosed disorders, and we have support groups in NAMI and as part of SAMAJ, which are run with groups. We have groups for South Asians, we have groups for Chinese Americans, African Americans, Latinos, and obviously other support groups that are general, not just culturally based. But these are both for folks who have been diagnosed with an illness and also for their families, because we understand that families are super important in helping both coping with an illness and also helping to reduce the recurrence of these illnesses, like I described earlier. So the professionals who've come together, we are now known as SAMBV, and we really focus on what we call mental health literacy, helping folks understand more about mental health disorders, but again, also how to prevent mental health disorders, given the stresses that we have as a new community developing in the US. There are stresses from work, immigration, our kids' own emerging identities. These are all levels of stress. And again, many of these mental illnesses can be diagnosed in adults also. So we may see it in ourselves or in our friends or in our family members. So this is something very, very important. So SAMBV is the professional organization that we've created. And our focus is really to help all of you develop this understanding and also create family environments that are supportive. And I've provided the email address. If you're interested in getting more information about SAMBV, please contact, that's my personal email. So I will try to respond to you or forward it to Aruna or the rest of our group and try to address any of the questions or concerns you have. Okay, so with that, I went a little bit over time, but I just wanted to give you a sense of what we would like to present to you in the future. So with that, I'll end. Thank you.
Thank you, Dr. Aparna. Now, if any of you have any questions for Dr. Aparna, please post them in the chat window. I will ask them one by one. I don't see any questions so far.
Okay.
Okay, so let me continue. It is important for us to teach important mental health habits to adolescents to achieve overall well-being and set the stage for positive mental health in adulthood. Thank you so much, Dr. Aparna, for sharing your knowledge and educating us on promoting success, reducing stress in teens by utilizing effective communication skills, identifying the emotional needs of our children, symptoms of stress, depression, anxiety, and substance use, and the positive coping mechanisms. Also, thank you for informing us about the support groups. We're really grateful to you and Ms. Aruna Rao from NAMI. I would also like to thank Mangalorean Catholic Association of East Coast Executive Board, all the speakers, viewers, and supporters of our Empower Me series session, and members of our Social Activities Committee. Our sessions are normally held on 4th Sunday of the month at 8:30 p.m., but due to Easter and spring break, we had to move the date for this month. If you are interested in giving a talk, or if you know of someone who is interested, please let us know by sending your email at sac@mca-ec.com. That's the Social Activities Committee. I don't see any more questions, so I guess we can end it here. Thank you, everyone. Good night, and Dev Bari Raat Din.
Thank you.